PPE, is my scene safe? And if so, is this my only patient?
Yes.
Okay, it's my only patient. So we're going to determine mechanism of injury. He looks to be cool with clammy skin, and he has head injury. He's fallen off a ladder. It looks like I see the bump from here. And so we're going to request for additional EMS assistance if needed. And we're going to check his ABCs right now. So I'm going to go ahead and check his airway. He's unconscious. He doesn't respond to any stimuli. And so we're going to check his airway. Everything is clear. And we're going to check his pulse. And that's good. And then his breathing is, what's his breathing at?
It is 22.
He's breathing 22 per minute with irregular chest fall.
No, Jason. Adequate chest falls.
Alrighty. So then we're going to go ahead and do my secondary assessment after I take his blood pressure. I'm going to take his pulse real quick. What's his pulse rate?
Pulse rate is 100.
Alright, so he's got a pulse rate of 100, so little, so it's just fine, just peachy. It's a good pulse, you know. My dad always said that's a great pulse. Anyhow, put this on.
Blood pressure is 160 over
What's
80.
his pulse rate?
Pulse rate?
I mean, not pulse rate. What's his blood pressure?
160 over 80.
Alrighty. After doing that, we are now going to do our secondary head-to-toe assessment. I'm going to check his head. Anything on top of his head or on the back of his head?
There's a
I got a hematoma on the back of his head right here. So a little bump right there. He seems to have cool, clammy skin. And then his eyes, everything looks good there. His airway, his mouth is all good. Airway is good. Nose is good. I'm going to check his neck now. None of the veins seem to be popping. And this trachea looks to be in midline position. And no decap, BTLS anywhere. And then we'll go to his shoulders. And then we'll check the back of his spine as well. And there's nothing abnormal about that. Then we'll check his shoulders and everything. No decap, BTLS there. Check there's no abnormalities with his arms. So we're going to go to his chest area. We're going to look around, feel for decap, BTLS. And there seems to be nothing wrong right there. His ribs are not broken. And then we're going to look at his stomach. And his stomach doesn't have any decap, BTLS. We would have checked the genitalia area. And it seems to be fine. He's not having a erection. So obviously there's nothing wrong with anything there. Then we'll check his lower legs, check his thighs. No abnormalities all around down to his ankles. And so with that, since he has cool, clammy skin and he's unconscious and he's breathing okay, I would still probably put on oxygen and immediate transport to the hospital. And then we would reassess the patient every 5 minutes. And this is my primary patient. Yeah.
Yeah.